Intriguing.
Time now for Your Life segment. Many kids have painful ear infections.
And new research shows a flu mist spray might actually prevent them.
Joining us now, Dr. Cecille Sulman from Children's Hospital and the Medical College of Wisconsin. Thanks a lot for coming in this evening.
It's my pleasure to be here.
How common are ear infections in kids?
Very common. It's the most common reason why children under 5 would have to go to see their doctor. It counts for billions of healthcare costs and dollars per year.
Yeah.
Dr. Sulman, can you explain how flu mist might be able to help parents and kids?
Well, research has really proven that flu and colds can cause inflammation in the back of the nose. So although the flu may not be directly responsible for ear infections, it's that swelling that causes changes at the back of the nose, of the eustachian tube, that causes negative pressure in a very favorable environment for bacteria to grow.
So how and where do you administer it? Is it through the nose or in the ear, or where do you administer the flu mist?
There are 2 different types of vaccines for the flu. You can have the flu mist through the nose, and that's a very weak live vaccine. And there's also a shot which has also been demonstrated to be preventative ultimately for ear infections.
Dr. Sulman, there was a time when doctors used antibiotics all the time to treat them. Is that kind of, are you shying away from that as a treatment, of course?
Well, if a child comes in for acute ear infection, it's really important to treat because ear infections can have serious consequences and complications. So if a child does have them, it is important to go ahead, see your healthcare provider and get treated right away.
Yeah, anything else that parents should know if their kids are having constant ear infections?
Absolutely. You want to keep in touch with your pediatrician who may refer you on for surgery, but probably the most important thing is prevention. So prevent things by reducing your risk factors. Get your vaccines. 2 additional vaccines that are really helpful to prevent ear infections are the Prevnar and Hib, which your pediatrician will administer. And those bacteria are really one of the most common causes of ear infections. Also, reduce your risks. Avoid tobacco exposure around your children. Don't feed your baby lying down. It's unavoidable. A lot of children have to go to daycare, but that is also also a risk factor.
Yeah.
What can be protective, however, is breastfeeding. So that is a positive factor to prevent ear infections.
A lot of benefits to breastfeeding. Dr. Cecille Sulman, we do appreciate you being with us this evening.
Thank you.
A lot of excellent advice.
Thanks for having me.
Thank you.